For some Providence physicians and nurses, they've been striking for 3 days as of this Sunday, and they're still going strong. For those here at the picket line at Providence St. Vincent, they say there's no end in sight until Providence meets them with a new proposal that does not resemble what was on the table before the strike.
We are all, ready to settle this contract, but, we need true engagement. And we haven't seen that.
As Providence gears up discussions with federal mediators about the process for resuming negotiations with their Newburgh and Medford locations, physicians and nurses at St. Vincent are wondering, why not them?
It feels like gaslighting, honestly. And fixing problems at one hospital versus fixing problems at another hospital doesn't solve the problem. That we all do the same jobs everywhere we work.
In a press conference Saturday, Providence said they were starting with Newburgh and Medford due to many nurses going to work despite the strike and feeling that a lot of their differences were already resolved before the work stoppage.
It seems par for the course with what we have been hearing from them with this tactic of dividing the larger group. And picking and choosing who they want to interact with when all of us are here waiting.
Physicians and nurses say they need better staffing to better care for their patients and claim the state's safe staffing law is just the bare minimum.
The numbers are the bare minimum that we should have to staff the hospital, but when you have a nurse taking care of a very complicated patient, a lot of times it should be one-on-one as opposed to different ratios that they propose.
Despite Providence offering nurses raises and physicians compensation increases and incentives, the workers say it's not just about a paycheck.
What we need is for all of us to get a retirement package we can use and a benefits package overall that allows us to keep staff from going to other hospital systems.
We've gone through a huge number of nurses leaving our program to go elsewhere because of compensation and stress levels.
When asked Saturday what would be different in the next proposals, specifics weren't clear.
So I'm not at those tables. These are individual hospitals, and they are the teams that bargain those agreements.
In a statement Sunday, Providence wrote that earlier, they provided summary details of the proposals on the tables that union leaders have rejected. They continued in part to say that going forward, they plan to work with mediators to establish a schedule and anticipate other hospitals and bargaining units will be ready soon. They concluded saying they hope union leaders put the interests of their nurses first, not just their desire for increased power, and their bargaining teams at each hospital work to reach agreements as rapidly as possible.
Providence makes us sound like we're greedy physicians and nurses, and it's almost like a knife to our hearts. We really give our lives and love to our work.
In Portland, Celine Stevens, KGW News.